I'm here today with Dr Ollie Minton, who is a consultant at St George's Hospital, South West London, and an honorary senior lecturer in palliative medicine. Thank you very much for joining us today, Dr Minton. Can I start off by asking, why did you choose palliative medicine?
I think, like most people, there was an element of serendipity. I'd finished medical SHO training. I wasn't entirely convinced of any of the specialties. I failed to get an ITU job, and to seek employment I got a job at the local hospice, and from there the interest just took off. I found the contrast from a hospital completely different. Really enjoyed the teamwork and felt this was something I could do. Stayed there for a year, and then the logical step was to get a trading number, and the rest, as they say, is history.
What would you say is the most exciting new development in palliative medicine?
I think relatively we're still a young specialty, in that it was only recognised by the college sometime in the 1990s as a separate specialty. So we're still jostling for position. I think what's exciting is the recognition of just how important and how cross-cutting and broad our specialty is. We no longer just deal with cancer, we deal with lots of long-term conditions. We're recognised in our service, being in a hospital, we're recognised as the role we have, not just at the end of life, but in advising, in helping to keep people out of hospital, and, as I say, dealing with a range of diseases. So the breadth and our involvement across the board is really very exciting. And within that, we're then growing research and education, all the other things you'd expect from a well-established specialty.
And what would you say is the biggest topic for discussion within palliative medicine at the moment? So if you were a trainee and you were thinking about going into it, what was the hot topic?
I think within the specialty, it's still around end-of-life care.
Okay.
Not least the assisted dying and the role we may or may not have as a specialty within assisted dying, and the cyclical nature of the legislation around that. So that's an ongoing thing. The other thing is really going back to basic end-of-life care and the one chance to get it right document, and trying to develop a national strategy so that it becomes a standard thing that everyone is able to do. I think what's exciting and what's challenging in the specialty is knowing that everyone should be able to do what we do, but there is an element that is obviously specialist, and trying to separate those two things out.
Okay. Thank you very much.